Today, the Australian Government is providing additional support both on the containment front and on the capacity front for Victoria's healthcare system. In partnership with the Victorian Government, we will be providing an additional 1,000 ADF members. Those members will serve in a variety of roles. They come on top of the approximately 350 that we currently have in place, and those 350 include approximately 120 supporting police at checkpoints across the lockdown zones, 188 that are working in supporting the testing regime. We also have a variety of supports in terms of police assistance and logistics assistance in different areas of the Victorian response. It's our job, though, to provide additional support. Throughout the weekend, I know that the Prime Minister was working with myself, with the new Secretary of the Health Department, Professor Brendan Murphy, with the Acting Chief Medical Officer, Professor Paul Kelly, in putting together a package of support for Victoria that was offered on Saturday and it was accepted on Sunday. 1,000 ADF personnel will come to Victoria with the support of and with the acceptance of the Victorian Government in partnership between the Commonwealth and Victoria. This is to protect Victorians, to help contain the virus. The roles will include activities such as isolation, testing, follow-up and checkpoint control. Those final roles will be determined in conjunction with the Victorian Government, but they will help meet the state's needs. So our first task is containment. All up, of course, we have closed the borders to protect Australians while still allowing Australians home, but a reduced number in order to make sure that the hotel quarantine system, which is operated in 7 out of 8 states, in an incredibly effective way, but here in Victoria, where it needs to be strengthened, is fully strengthened. Secondly, with regards to the testing, we have now passed over 3.1 million tests. These tests are identifying cases. They are allowing us to track and trace and therefore to isolate. In terms of the tracing, around the country, that system has been incredibly important. It's playing a hugely significant role in helping to find the cases associated with the Crossroads Hotel. Today, 8 further cases in New South Wales associated with the Crossroads Hotel have been identified and 2 further within the community. So we are taking those very seriously. New South Wales is, however, conducting an absolutely comprehensive response to the Crossroads Hotel outbreak. And then finally, we have the distancing measures. And that distancing measure can mean 1.5 metres. If you can touch somebody, then you are too close if they're not a member of your immediate family. It includes the role of masks as a preventive measure where you cannot otherwise social distance. It also includes the cough etiquette and all of the elements that are about taking care of each other, above all else responding to the restrictions in place, the difficult restrictions in Victoria. Then that leads to the second area, which is capacity. I'm announcing 5 million masks from the National Medical Stockpile today for supporting Victoria in its response. 1 million of those will go to primary healthcare workers. They are currently being prepared for distribution through the primary health networks, and 4 million will go to the aged care system and the home care system. These are very important distributions to allow for greater use of PPE to make sure that all of the needs are met. We are getting ahead of the curve, and this will be fundamental. We know that our aged care homes are an area of risk. We have seen the Menarok outbreak, and we have responded in conjunction and in partnership with Victoria to make sure that each person within that facility who has been infected, and that every person who hasn't been infected is given specialised care and treatment, and where hospital is required, that's being provided. Where isolation is required and separation, that's being provided. So that finally leads me to the last element of capacity, which is the hospital system. I want to reaffirm that we have been focusing very closely on the capacity of the hospital system to meet high volumes. Currently, there are 92 people with COVID in hospital across Australia, 18 now in ICU, and I'm advised that there are 15 in intensive care across the country. So against that background, the advice provided to me by the National Incident Centre shortly before joining you is that there are strong reserves of surge capacity, in particular obviously within Victoria, but around the country. So this is a challenging time, but the additional Commonwealth support is to help with the containment and to help with the capacity. The capacity is strong and planned. It was already planned for an outbreak before this virus arrived, but it's been strengthened during the course of the virus.